Before I enter the patient's room, I will review provider's order for indwelling Foley catheter insertion. And the patient had a kidney surgery, and doctor ordered a Foley catheter. The patient met the requirement, and now I'm going to proceed the insertion. First, I will gather the supply that will include the indwelling Foley catheter kit, the glove, the towels, and the basin. And I'll check for the sign and precaution before I enter the patient's room. Knock, knock. May I come in? And I'll provide privacy and perform hand hygiene. Hi, Mr. Miller. My name is Ife. I'm the nurse to take care of you today. How are you feeling? Good. May I verify your full name and date of birth? Good. And your doctor ordered indwelling Foley catheter for you, so I'm here to place the catheter on you. The catheter will help you to empty your bladder without having to get up and go to the bathroom. It can also help you to recover from the surgery. Now, before I start, may I ask you a few questions? Okay. Do you have any history of bladder infection or kidney stones? No, good. Are you allergic to iodine, betadine, or latex? Okay. Have you had a Foley catheter before? Okay. And when did you last urinate? Any blood in the urine? Did you have any difficulty urinate or any abdominal pain? No? Okay, very good. Okay, now I'm going to go ahead and prepare the working area. I will wipe down the bedside table with the sanitized wipe, and I'll put the blue pad on the table. Then I'll put the catheter kit on the pad. And then I will perform the hand hygiene. Then go ahead and put on the glove. Okay. And first, I will raise the bed to the comfortable position for me, and I am right-handed, so I'll be working on the patient's right side. And I'll place the patient in the supine position with his legs straight and slightly apart. Then I'll put a waterproof pad between his legs. Okay. All right. Okay, now I'm going to perform the pericare, and I'll be using a washcloth, warm water, and soap to clean the area, and I'll rinse the area, and now the skin is dry and ready to go. And I'll go ahead and remove my glove and perform hand hygiene. Okay, the next I'm going to open the plastic bag of the kit. So we're going to open the plastic bag and take out the kit. Okay, and I will take the plastic bag on the foot of the bed so we can use that as a trash bag. Okay. First, I will take out the blue drape. Only touch the 1-inch edge. And put the drape between patient's leg with a shiny side down. Okay. And then I'll go ahead and pick up the sterile gloves. Okay, going to put the finasteride drape over the peanut. And I'll go ahead and open the sterile antiseptic swab. I'll leave the stick side out. And also, the next I will squeeze the lubricant and take out the catheter. And I'll remove the covering. And dip the catheter tips in the lubricant. Okay. Leave it there. And next I will attach the syringe to the balloon port. Okay. Then go ahead and move the box to the between patient's leg. Okay, I'm going to clean the peri area first. I would retract the foreskin, then grab the peanut. Okay, now it's clean. So pick up the catheter and start to insert, and I'll hold the peanuts at 90 degrees. And I'll ask the patient to bear down and take a deep breath. Mr. Miller, now go ahead. Now I can see the urine is draining. And go ahead and advance about 2 to 3 inches. Okay. All right, and go ahead and inject the saline to inflate the balloon. Okay. Go and detach the syringe. Okay, I'm going to gently pull the catheter, make sure it's secure in the bladder, and there's a resistance. Okay. Now I'm going to tape the catheter to the patient's thigh. And I will put initial and date and time on the Foley bag, then hand it back on the bed rail. Okay, supply. And I will wash and dry the peri area if you need it. Turn the patient to the comfortable position and lower the bed and give the call light. And now I can remove my glove. And I'll perform hand hygiene. Then I'll document the procedure. And this is the 14 FR Foley catheter, and I have one attempt and the patient tolerate the procedure. The amount of sterile water in the balloon is about 10 ml, and the urine looks yellow and clear, and the about 30 cc, and there's no complication with insertion. Right now it's time to remove the catheter, and I'll perform the hand hygiene, and I'll put on the glove. And I'll go ahead and explain the procedure to the patient. Hi, Mr. Miller. My name is Yifei. Today is time to remove your catheter. I'm going to first provide a privacy. How are you feeling? Did you have any pain? No? Okay, good. First, I'm going to empty the collecting bag. Then next, I'm going to place a waterproof pad under the peri area and between the patient's leg. The next, I will attach the 10 ml syringe to the balloon port. And allow to fill with the water. Okay, once it is filled, I will remove any additional water from the balloon and remove the syringe. I'll empty the syringe and reattach to put all the remaining water from the balloon. Once the balloon is completely deflated, and I'll go ahead and put out, I will ask the patient to take a deep breath in and out and gently and quickly pull. Mr. Miller, go ahead and take a deep breath in and out. Once the catheter is removed, I will provide pericare. Then I'll document the procedure.